A report released Tuesday by the Centers for Disease Control and Prevention found that Oklahoma doctors wrote almost 128 opioid pain reliever prescriptions per 100 people in the state. As our Jacqueline Cosgrove wrote in today's Oklahoman, Oklahoma physicians write enough prescriptions for powerful painkillers to fill a bottle of pills for every man, woman, and child in the state, and then some. Now, according to the report, Oklahoma ranked number 5 in the nation for highest rates of prescribed hydrocodone, oxycodone, and other powerful painkillers to residents. I'm joined by Terri White, Commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. Thanks for your time this morning.
Thanks for having me.
And Terri, I'm guessing you're not surprised by this report.
Unfortunately, I'm not. We have a huge addiction problem in the state of Oklahoma. And often when we talk about it, people are like, why Oklahoma? And I say, look at all of our diseases. We have high rates of all diseases, so it's not surprising we have high rates of brain addiction. It's simply a different organ in the body. The problem is that we have a whole group of folks who could do something about it, and so far that's not happening.
Well, this may be a very generic, obvious question, but perhaps you can get into this. So why is this bad? When you see these numbers in a report, why is it bad? Okay,
so one of the things I saw in your report yesterday, which I thought was fantastic, is helping people understand we had more people die last year from prescription overdose death than from car crashes in the state of Oklahoma. We have more people die from specifically painkiller, opioid prescriptions than we do from meth, cocaine, and heroin combined. We're talking about almost 500 of our coworkers, our friends, our neighbors, fellow Oklahomans.
And so what's causing this? Just physicians saying, okay, Dave, you came in with a knee ache, I'm going to write you 2 prescriptions. Is it that simple and just adds up, or?
It's a complex problem, and what we know is that the majority of physicians are trying to do the right thing for their patient. The majority of physicians, however, aren't using the PMP system.
Explain that for us.
Sure, the PMP system, we actually have one of the best in the nation, so it's shocking that we're not utilizing it. It's a live, real-time system that lets a doctor know, if you're my physician and I come in and ask for a script, have I gotten a script from 3 other doctors in the last 2 days or the last 2 weeks or the last 2 months? Most physicians aren't utilizing it to its full capability or checking it at all.
So they have a database that would have all of my past prescriptions, or basically my doctor's file for any doctor I've gone to, and they can say, hey, Dave has had X, Y, and Z prescriptions.
Absolutely. And we've had some physicians who said, we don't believe the system is going to do what we know other states have seen it do. New York, Tennessee, places that have mandated its usage before a script has been written, has seen a significant decrease in prescribing practices. And what we're not suggesting or mandating how physicians practice. That is what they're trained for. But making sure they have all the information before they prescribe. And states who have done this see a significant drop in the number of scripts written. And physicians just simply don't realize how many people in front of them are doctor shopping.
But why not? Why wouldn't they use this? Extra time, or?
So we've heard several things, and there's a lot of misinformation out there, one of which is extra time. But one of the things that we're proposing is that staff check it. And here's the thing I say. Every time I go to the physician, whatever I go for, allergies, whatever, they check my blood pressure in case I might be having a heart attack. I'm not high risk for heart attack. Yet we're not checking a very simple tool that we know over 600 or close to 600 Oklahomans are dying from each year, which is prescription drug overdose death. But it's not just a physician issue. We all have a role to play in this. And that's why the governor's prescription drug plan is so incredible for the state of Oklahoma, because it talks about the role of physicians in terms of prescribing using the PMP. But it also talks about the role of law enforcement, the role for you and me as general citizens, making sure we dispose of our unused prescriptions correctly. As you mentioned, there's a huge number of scripts written, whether it's someone who has a fender bender, has some dental work, whatever it might be, gets a 30-day script but only takes 2. Most people, it still sits in their medicine cabinet, 28 pills, 2 years later. Well, if you have teenagers, if you have friends, even open houses, the realtors are struggling with people stealing prescription drugs out of people's medicine cabinets during open houses.
Shut up.
I swear. And so one of the things we've got to talk about is how do we all play our role? So all of us joining in the law enforcement efforts to appropriately dispose of our medication, not keep them in the medicine cabinet, making sure that we are educating teachers, parents, the education component that's so important that you guys have done a great job partnering with us on in the takeasprescribed.org website, but then also having our physicians step up, as this report says, when we are prescribing 128 pills per 100 people in Oklahoma. That's too many.
I just thought people looked for the freshly baked cookies when they went to open houses. Didn't realize they were checking the medicine cabinet.
No, it's a huge problem in Oklahoma, but it's one that we could actually win. It's one that we could do something about. We could save lives and we could prevent the heartbreak that so many families go through. The Box family that you guys have shared their story on, when they lost their son Austin, an amazing young man who never intended to get addicted to prescription drugs but had a back injury during football. But so many scripts are written, so many pills are available, they're everywhere. We have high school students telling us they could get prescription drugs in less than 30 minutes in the high school.
Well, that's scary too, especially with football season coming around, and you may see some more of that. But it's not just physical pain; it could be some mental pain as well. There's prescriptions for that, right?
Mm-hmm. Absolutely, and
depression or
yes,
something.
absolutely. And a lot of those drugs aren't addictive. However, the benzodiazepines, can also be something that's abused, which is another reason, particularly when we're talking about physicians. Many people see a different physician for their mental health issues than they do their physical care. We need to change that. We need to have all care happening in the same place. And we have doctors that have been amazing that are partnering to educate themselves about this and to learn how to look at whole health, which I think is incredible. But without that key component of what medications is the person in front of you on, it's really hard to see the whole continuum and do everything you can do.
Seems fairly obvious. I'm not a doctor or an expert by any means, but seems like that's some common sense.
And we're really hopeful this year that this is an effort and a fight that the physicians are going to be able to join us in. We worked hard together last year to try to come to a compromise. In the end, we got to the point where the governor said we can't sacrifice one more Oklahoma life. We have to make checking the system mandatory. And at the time last year, the doctors couldn't agree with us. I'm hoping the new report, which also shows that other states who mandate the PMP usage significantly decrease overdose deaths and the number of pills prescribed in the first place, may change their minds this year.
Very good. Terri White, Commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. Thank you for your time this morning.
Thanks for having me.
And the website she mentioned, takeasprescribed.org. We also have continuing coverage available on our website at newsok.com.